My name is Dr. Valerie Garrett. I am a hospitalist and the medical director of diabetes at Mission Hospital. We are in the midst of a diabetes epidemic in the United States and in North Carolina. More than 1 in 10 of our adults have diabetes. 6 out of 10 of our adults have either overweight or obesity, putting them at risk of diabetes. For some time now, diabetes has been the leading cause of blindness and kidney failure in the U.S., and it is certainly a leading cause of heart attack and long-term heart disease. A small portion of type 2 diabetes is genetic. The big driver is weight and lack of activity. We all work hard. We have 50-plus work-hour weeks. We live in an environment that dictates we drive to work as opposed to walk. It is not easy to live a lifestyle that prevents obesity or diabetes. They're actually fairly modest. I think that there's a misconception in the region and in the community that one has to live the life of a monk in order to either lose weight or protect themselves from diabetes. Really, even moderate changes in diet, a lot of that comes around food quantity, and then even modest weight loss, 10 or 15 pound weight loss if you're significantly overweight can protect your future. One of the challenges that I face when talking to people about diabetes is that a lot of the research indicates that you need to exercise a lot. But in truth, any exercise is better than none. So ideally, 30 minutes at a time, 3 or 4 times a week, be it simply walking in your neighborhood, getting on a treadmill, some sort of aerobic exercise goes a long way. We have a great team. We have the Diabetes Center at Mission that includes all sorts of health coaches and educators around how people can protect themselves and foster healthy lifelong behaviors. We have nutritionists, we have nurses, we have pharmacists. Every one of them is passionate about diabetes. We offer what we call customized programming. You can either have one-on-one contact with a nutritionist or health coach, telephone contact, or more intense, what we call our high-intensity program, where you go to class for a few weeks to really ground yourself in the basics of diabetes. You do ultimately require a referral. If you have an interest in being referred, we welcome direct contact through the phone, and we can guide you on how to talk with your doctor about making that referral happen. Years ago, getting the diagnosis of diabetes was sort of like a death knell for people, and now folks still really fear that diagnosis, and they fear medication for diabetes. In actuality, we've come a long way with both the medical treatment for diabetes and the medical treatment for its complications. So the more you know if you have diabetes, the more empowered you are to protect your future. Don't be afraid, act.